If you have Medicare, whether it's Original Medicare or a Medicare Advantage plan, you have certain rights and protections. Acentra Health is the beneficiary and family-centered care quality improvement organization for the 29 states shown on this map. We help people with Medicare file complaints about the quality of their medical care, get help with issues that need to be handled right away through our Immediate Advocacy program, or request an appeal in the following situations. They are being discharged from a hospital too soon. They are placed in observation. Their hospital admission was denied. Skilled services like physical therapy are ending. The focus of this video is the Immediate Advocacy Discharge Assistance, or IADA process. But we are going to start with the Immediate Advocacy process, which IADA is part of. If you're on Medicare, you may have more help than you realize. There is a free service from the Centers for Medicare and Medicaid Services, or CMS, called Immediate Advocacy. It includes another option called Immediate Advocacy Discharge Assistance. Immediate Advocacy is offered by Medicare through organizations called Beneficiary and Family-Centered Care Quality Improvement Organizations. It is available for people with Medicare or a Medicare Advantage plan. You don't need a lawyer, you don't need to file a formal complaint, and you don't need to request medical records. Instead, someone from Acentra Health steps in to assist with communication between you and your healthcare provider to try to resolve concerns quickly. This can include issues like trouble understanding your care plan, problems getting services or equipment, communication breakdowns with hospital staff. Most issues are addressed within a few business days. Have you or a family member ever been told that your hospital discharge is scheduled for the next day, but you didn't feel ready to go? Immediate Advocacy Discharge Assistance focuses on hospital discharge concerns. It is only available to Original Medicare beneficiaries who are currently in an acute care hospital and have received a notice that discharge is planned. IADA can help explain your discharge plan in plain language, ensure communication between you, the hospital, and case managers. Help make sure your concerns are heard and clearly understood. This process does not replace your right to appeal a discharge, and it does not affect appeal deadlines. It simply provides additional support and clarity during a stressful time. It's important to know what Immediate Advocacy and IADA can and can't do. They help with communication and work collaboratively with providers. However, they do not review medical records, decide medical necessity, or guarantee a change in discharge timing. The goal is to make sure you understand what's happening, know your options, and feel supported in the process. To request immediate advocacy or discharge assistance, you or your representative can contact Acentra Health. Their contact information is listed on hospital discharge notices, or you can find it through Medicare resources. Leaving the hospital can be overwhelming, especially when you don't feel ready. Immediate advocacy and discharge assistance exist to make sure your voice is heard, your questions are answered, and your concerns are addressed. You don't have to face the discharge process alone. For more information, visit the Beneficiary Immediate Advocacy page on our website or call our helpline. Phone numbers for each region are available at AcentraQIO.com. If you found this video helpful, please subscribe to our channel and click the notification bell to learn when we post new videos. For more resources for people with Medicare, visit AcentraQIO.com/Benny. You can also find helpful links in the YouTube video description.